Are you experiencing pelvic floor dysfunction with weakness and tightness in one side, and then all the way goes up, you have a one-sided jaw pain? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, I'll be demonstrating temporomandibular joint release, self-myofascial, on how to open this grinding tightness on your masseter muscles and how there's a big correlation with pelvic floor tightness, weakness, and dysfunction. So with my history, as I'd like to share to each one of you, I used to have a TMJ pain on my left side when I was working as a home health physical therapist, driving like 8 to 5 hours a day, 5 hours a day average, driving far from my starting point A to point B, all around San Diego. And this results to instability of my TMJ with the forward head round the shoulder posture driving for 4 years, as well as one major mistake of my dentist who did too much anesthesia during my filling on my molar that results to locking on my jaw. And that's also from a history of my pelvic floor. I didn't realize I have a lot of tightness on one side, being a side sleeper as well that compresses my TMJ. And that's why, since I've been releasing my TMJ, it's also helped my pelvic floor issues when I used to have, as I would like to share, my intimacy has pain on my beginning parts of my pregnancies. In the beginning part of my marriage, not knowing it's not normal. But now, with years of experience, applying it to myself, helping thousands of my patients, I finally figured out how to release my TMJ. Not just the usual TMJ exercises we learned in school, but also a deeper stretch, releasing the masseter with some deep myofascial release, as well as lymphatic drainage. And here I'm going to show you using your clean hands. You don't need gua sha. All you have to use are your fingers and gentle pressure and movement on your jaw. So let's begin the program. We're going to gently tap and open some lymphs first, tapping above the collarbone. And we can do both arms and do that for a minute with breathing. And after tapping your collar, where we're releasing and opening this area, I'm going to tap near your your jawline here. There's some lymphatics here, and tap gently to warm up first, some lymphatics. And then the other side, we're going to release both TMJs because they can, when you open and bite, even though you only have one side pain, you have to release also the good area, because it moves in kinematic chain. So that's why there's some gliding motion sometimes on your jaw, like this, when it's uneven. And when you bite, chew, and there's pain. And slowly look up to open more of the lymphs. And after opening the collar, underneath your ear, now in front of your ear, just tap gently for a minute, and then the other side. And after we open up everything, we're going to do a deep massage. Cross your arm underneath your collarbone here. So here's your collar underneath. You're going to press it gently in circles each side. And on top of the collarbone, just release some muscles there. The platysma bands it pulls your jaw down. That's why it's important to do some self-myofascial release with exercise. Okay, my friends, we're gonna get closer now to release this area. So now, after those beautiful lymphatics, now it's time to open. We're gonna make your index and thumb rest underneath your jaw. One arm over your temporalis. Gently push it down and gently open together with mouth opening. That lasts for 2 to 3 seconds. And after doing that at least 10 times, you can start diagonal from a little bit front of your jaw and your thumb underneath and your index bent. You pull back towards backward like that. And you're going to feel a deep ache and pressure. And after doing that, now you can progress with tongue movement, because the tongue, I know it's the hyoid muscle, but when you stretch, it furthers, it's like a deeper stretch and deeper release. So as you open, so this is intimate to show you guys my tongue and my teeth, because I want you to guys learn that you can do this. One more time. And it's so achy here. This is my left side. This is where I used to have lockjaw. I can't eat for a month. I was just drinking smoothies and it was terrible. So since I released this with my self myofascial release, so you can see the evenness of my face now. Now we have to release this side. One hand on top of your temporalis to pull a little bit, and your thumb and your index make a gentle pull down while you open your mouth. And now you're going to pulling it towards the jaw. And it's also achy because, as I said, they join together with movement. So this could be overwork from the weakness on this side. Now we're going to do with the tongue movement, still with the index from the cheek. Pull. And do that 10 times, slow, controlled movement. Now you can see my TMJ, it's morning right now, my swelling, my puffiness. And then you can combine both. And in, against the muscle fiber of your masseter. And it feels so good. It's painful movement, but it helps. And now the lower jaw, you want to press with your thumbs and back. And look up. With your tongue up. Lift and open. If you look down a lot on your phone, this gets tight. And release. And do that 10 times as well. Now, after releasing those areas, it feels so good. We can do with your hands out, palms out, open like this. One hand out. So as I'm going to pull back with the camera, so you can see palms out open, you lean and pull. And when you stretch this side of the muscles, it helps release the TMJ here, the pressure on your jaw, your neck, the tightness of your side of your neck, cervical neck, side flexors, and then you stick your tongue out away. So I'm sticking my tongue out to the right. And then I'm going to switch to the other side. Pull gently with your palms open. Gentle pull. It's like a nerve loss as well on your median nerve. And then stick your tongue out towards the left. As I pull to the left, my tongue is sticking out to the left. A deeper stretch. It feels so good on my right side. So alternating. Hold it for maybe 3 seconds for beginners. And then progress to 10. You're going to feel that lovely stretch here. And do that 10 times. So those are my lovely exercises. So those are the exercises you can start right now to help relieve pressure off your TMJ. And this will help your pelvic floor health as well. And there's more inside my Revive Pelvic Floor Health Core Rehab that you can learn from me with 20 years experience to help you with your pelvic floor issues. If you have diastasis recti, umbilical hernia, pelvic floor pain during intimacy, latchkey, bladder stress and urge incontinence, and different variations of weak pelvic floor, weak abdominal muscles. If you have C-section, postpartum complications, or if you're recently having symptoms that you never had before due to perimenopausal or menopausal symptoms, it's not too late to start strengthening the core With or without babies, everyone has pelvic floor issues. Sometimes it happens. That's why we need to strengthen, to cultivate that area, the basin that supports our core muscles. I'll see you inside my next video training. If you have more time today, check out my episode 1 of my journey series, my free 6-7 part video series. And this is about proper breathwork. Learn how to breathe properly. Until my next video training, always remember, be safe, be well, and healthy you. Bye.